I grew up in a medical family. My father was a physician. My first experience in the hospital was at age 13 as a volunteer in the maternity ward, and I got to see my first birth. So early on, I was tuned into women's health. In my residency training, in vitro fertilization was relatively new, and the excitement and promise of that new technology drew me to reproductive endocrinology. After my fellowship at UCSF, I started my own solo private practice as a single mother, but I always knew that I wanted to be part of a group. When I had the opportunity to join RSC in 1997, I knew it was a good fit. One of the strengths of RSC is its extensive experience. It now has more than 30 years of experience with IVF, and last year we had nearly 1,000 IVF cycles. I'm the medical director of Pre-Implantation Genetic Testing at RSC. This is a technique that involves removing cells from an embryo for a genetic test. Each embryo is tested for a known genetic disease or an abnormal number of chromosomes in order to determine the healthiest embryo to transfer back. For example, I had a patient who had a bleeding disorder that she had inherited from her father. She really wanted to have a family, but she didn't want her children to have to cope with the same illness that she had. With IVF and PGT, we were able to identify which embryo had the disorder and which did not. So now she has a healthy son without the worry or carrying the burden of guilt of him having to cope with the disease. Also, for her future generations, for her grandchildren, they don't have to deal with that genetic risk. RSC's experience with PGD goes back more than 10 years. As medical director of the PGD program, I belong to the International Society and I attend international meetings to learn about the newest technology. Each patient comes to me with their own unique story. My strength as a physician is my compassion. I take my time, I try not to rush patients, I try to explain to them in their own terms so they can understand their situation and help them make the best choice for treatment for them. Even more amazing for me is when I go out in the community, going to the grocery store, or to the gym, or to the theater, and I bump into my patients and I see them with their children, and they might be all IVF babies. It's so gratifying to see them live their dream.